So what we've done today is Karen wanted her Marionette line softening. So we've given a little bit of cheek support. We can do this. It's really important that we lift high up above, just so that this little fat pad that's slipping south, it's not just weighing too much weight here on the Marionette line. So we've injected some cheek support with a lovely soft dermal filler, and we've put some dermal filler straight into the Marionette. Like you say, when we're not talking or smiling, we do have this slightly drained, the under eye can look tired, this can look drained, and this can look a bit sad. So actually, I always ask my patients, as when I'm consulting with them, to give me a great big smile, and to see whether they upgrade when they smile. That's very important. Yes. And when they do upgrade, I know that I can really help them with very carefully placed amount of filler. And that's exactly what we've done here with Karen. We've put some support here, and support here.
How many syringes of filler approximately did you use just to subtly improve Karen?
Here we've used 1/2 ml under the eyes, in the tear trough. Here we've used 1/2 ml on the cheeks, and here. So today we've used a total of 3 ml.
Which I think is very conservative, actually.
Conservative, but patients often worry. They think that 3 ml is going to give them a rather puffy look, and not when it's carefully placed. Remember, we've treated here, we're here, and here.
Yeah. So the message of the day is fillers, when they're done well, are imperceptible. And actually people should, perhaps with one of the myths we're dispelling is fillers can look very, very natural, and people don't realise that, but it's technique, it's how it's done. That underpinning and contouring the face, the support and the actual contours of the face have to be, as you say, the right order. Priority number 1. All the fine tuning and all the other things can be done as priority number 2. And the secret is just enough, but not too much. As I said at the beginning, you want just enough filler, because I would say to a patient, if you undertreat, you underwhelm. If you overtreat, then we all know what that looks like. But actually, it's just getting just enough. Can we just discuss what happens to, as we know this saying, the lid-cheek junction as we get older, and what we're trying to do, what we're trying to achieve when we do a tear trough treatment?
The bony area of the eye, we start to get a little bit of bone reabsorption, so the socket starts to open up and eyes can sit back deeper. Little fat pads can start to herniate and come forward. The skin that used to be nicely tight, collagen, elastin like this, is now looser. So bones disappearing behind, fat pads coming forward, skin's looser. So this all presents to a patient in what they will say to me, oh, I'm feeling like I've got eye bags, feeling like I'm looking a little bit tired. We do a lot of tear troughs, and we've had amazing results when I've actually thought they did require a surgical intervention. So is it dangerous? It is an area that feeds a big, rich blood supply to the eye. We have to be particularly careful. Like you say, we've done a lot over the years. We adopted using cannulas many years ago.
So with all this bone loss, alteration of everything that's going on, what happens, isn't it, is that what we call the lid cheek junction looks lower. So it naturally morphs. So what we often do, and what Tara's talking about, is we will often, the tear trough and the cheek are inherently linked together.
They are, there's fat compartments.
Yeah. So actually by supporting all around with the cheek and then treating the tear trough, you get a really nice, seamless aesthetic result. So Tara, I'm going to ask you a really contentious question. Is filler in the tear trough painful when it's done, and is it safe?
Most patients don't find any pain, discomfort with it at all. And is it safe? Yes. You're having an experienced injector like ourselves, who've been doing tear trough treatments for many years, and we do a lot of them in this clinic. We consider it quite a safe treatment.
Good, and a treatment that gives really, really good results.